Well, it's welcome now to Dr. Ben Saxon from Adelaide Women and Children's Hospital. Welcome, and thank you so much for joining this discussion about children, adolescents and young adults. Can you introduce yourself and just give us a sense of the scope of the work that you do with children with cancer?
I'm the medical unit head of Paediatric Haematology and Oncology in Adelaide, and we provide chemotherapy, referrals to radiation, referral for bone marrow transplant, all of those things that children with cancers and blood disorders can be faced with. We have a pretty full service. We have on-site pharmacists which help us with our chemotherapy, play therapists, hypnotherapists, all of the really important people for helping a child get through their treatment.
Well, you know, this whole session is about what can we do to improve the radiation experience for children and their families. But of course, many of us who have radiation, I've had it myself, I also had chemotherapy. So what are you doing to improve the chemotherapy experience, particularly for younger children?
Yeah, so younger children, especially if they have to have radiation with it, they might have radiation in the morning under a general anaesthetic and then come over to our clinic to have chemotherapy in the afternoon. And this is a really big day for these children. So we try to keep the operation as smooth as possible. The child always goes first. The anaesthetist always goes with them. We make sure that if a child's old anaugh, they can adopt other ways of keeping calm during radiation instead of just with an anaesthetic. And then as soon as they come over to us, we make sure that we move quickly to give them their chemotherapy so they don't have to waste more and more time in medical facilities.
Perhaps you could explain what chemotherapy involves and how you keep children still if they need to be still for an extended period of time.
So usually, particularly with the younger children, we get one of our surgical colleagues to insert a thing called an infuser port or a portacath, which is a disc under the skin about here, and it's connected with a fine tube under the skin all the way into one of the veins at the base of the neck. And then that's all under the skin so the child can play sport, go in the water, have a bath, do anything with that port in. And then on the day of chemotherapy, we put some cream on to numb it, and then we put a needle directly into the port to administer the treatment.
So they don't have the experience of pain and the skin being pierced?
No, they might feel a bit of pushing. So, in fact, the most nervous children actually get more worried about being held in position so a nurse can safely put a needle in it. And that's where, particularly with kids over about the age of 5, we get one of our anaesthetic colleagues or one of our experienced pain nurses to help with some self-hypnosis techniques so that the child can relax into another place while we do these procedures.
Is there anything else you'd like to highlight that you're doing at the Women and Children's Hospital with children being treated for cancer that's about improving their experience? We have seen examples of play therapy, not so much music at this stage, but what sort of things do you do?
We have a music therapist who is just loved by everybody, as you could imagine. And she tailors programs to different children at different age groups. And even during COVID, she was making her sessions available on recorded Zoom for the children. And it's not just playing music, but it's getting the child involved in the music, and it's another way of taking them to another place.
Before I let you go, Ben, the first 2 webinars in this series on improving the radiation experience for patients and families, the first 2 were about proton therapy, which is of course coming to Adelaide first in Australia. I think first patients expected to be treated in around 2024. And the Australian Bragg Centre for Proton Therapy and Research is, I think, at the moment a building site very near to where you're sitting now, near the Royal Adelaide, and you're part of the consultations happening there. In a nutshell, in the work you're doing as someone who works with children all the time, cancer patients, 2 or 3 things you're hoping the Bragg will achieve to improve the radiation experience and to have that kind of linked and seamless connection to the Women and Children's Hospital in Adelaide as well?
Well, firstly, it'll be closer because around about the same time we'll get a new Women's and Children's Hospital just a little bit along North Terrace. So that'll be a huge bonus. The layout of the reception and clinic area is really child-friendly. We've had a lot of input into that. Myself and some nurses and play therapists and music therapists, and it's looking really promising. And then in the bunker, there's separate areas for young children with activity areas and a little hideaway place for teenagers because they like hideaway places, basically. And the plans look phenomenal for all of these things. So I'm really looking forward to having a non-frightening experience for something that is pretty much intrinsically frightening.
Yes, well said. Well, Ben Saxon, it's just a delight to speak to you, and thank you for joining us for this session that's focusing so much on children, adolescents and young adults. It's really great to meet you. Thank you.
Thank you.